New information about pregnant women who get the COVID-19 vaccine. The CDC says it can prevent the hospitalization of infants under 6 months old. And tonight, local health officials continue to encourage pregnant mothers to get vaccinated to protect themselves and their babies. Our Kylie Jones talked to an upstate doctor who explains what moms should know. Kylie?
Yeah, that doctor tells me a vaccinated mom-to-be is passing that immunity straight to her baby really before it's even born. He also emphasizes it is safe to vaccinate during pregnancy, adding they do a number of vaccines as well.
The vaccinated moms whose babies are born with some protection, those babies do better than babies who are born without that protection.
The CDC is reporting if an expecting mother is fully vaccinated against COVID-19, it can help prevent hospitalizations in babies under 6 months.
Babies born to vaccinated moms in the first 6 months of life are much less likely to even need a hospital admission if they were to contract COVID-19. So that's showing us that if I vaccinate you as a mom, you're passing that immunity down to your baby and protecting them for at least the first 6 months of life.
Dr. Jason Hill says those babies are born with that protection.
The vast majority of the patients who are having these complications from COVID-19 are our unvaccinated patients.
In a study, the CDC said a 2-dose vaccine in pregnant women was 61% effective at preventing their babies under 6 months from being hospitalized. Dr. Hill says they also recommend expecting moms go a step further and get a booster shot.
We're seeing a lot of patients who did get the vaccine when it first came out and now are newly pregnant, and they have questions about boosters. And boosters are wonderful because it does exactly what it says. It boosts that immune system response so that the level of protection floating in mom's blood can then be passed to the baby.
He says the level of effectiveness doesn't change based on whether you get vaccinated before or during your pregnancy.
From what we've seen, there is no data to support any adverse effects for the pregnancy from the COVID vaccine, no increase in miscarriages, anything like that.
Now, Dr. Hill, of course, encourages mothers and future mothers to talk to their doctors. He says there's not enough data out there yet to determine whether pregnant women need a 4th shot. Live in Greenville, Kylie Jones, WYFF News 4.